It is 8:23. May is Stroke Awareness Month, and every year, nearly 800,000 people in the United States have a stroke. Recovery can look very different for every person, and for many survivors, therapy plays a major role in getting back to everyday life. Joining us this morning is Jamie Farrington, a speech-language pathologist with Mary Free Bed Rehabilitation Hospital. We appreciate your time, Jamie. Thank you so much for being here.
Absolutely.
First, let's talk about a stroke. I think we all kind of know what that might look like, but if we don't, what exactly happens during a stroke? Why is treatment important in these scenarios?
Yeah. So our brain is filled with a lot of networks that carry blood and nutrients and oxygen to the brain. And when a stroke happens, there's just some sort of interruption to that. So that could be a blockage or a rupture. And so when there's no oxygen to the brain, then cells die. So it's really important to seek medical attention right away. And there's a good critical period after that stroke that it's important to start rehab.
Yeah, and that's where you specifically come in, especially on the speech-language pathology side of all of this. Let's talk about the short-term and long-term impacts and how people recover at different rates. In your experience, what does that look like?
Yeah, so it does depend on the person. It depends on the location of the stroke, how severe it was, time since the onset. So it does depend on a lot of things, but we can reduce the risk of strokes by acting quickly when those symptoms start.
Okay. Let's talk about, what factors help us improve. Let's speak specifically about speech. What does that look like when you are teaching somebody how to speak again or walking them through that? What does that process look like?
Yeah, so we start with an assessment to determine what difficulties they're having after stroke. It really depends on where in the brain the stroke is.
Yeah.
But we start with, at least in inpatient rehab, they have 3 hours of therapy every day. From a speech therapy side, we work with everything from kind of the neck up. So we work with speech and voice, swallowing disorders, and cognition. So things like memory and attention. And we start to identify what are the areas they're having difficulty with and some strategies to help them improve their ability to be independent.
Yeah, and when they are independent is when they can kind of transition back to their home life. What does that look like? What is that transition period from the rehab hospital side of it back home to trying to live out normal life after that?
Yeah, so we really focus on caregiver education and working to prepare them, whether it's equipment needs or strategies. So they'll work with the therapy team to identify what other additional therapies they need, whether that be physical therapy, occupational therapy, or speech therapy, and they may start that as an outpatient when they go home.
Yeah. When you guys send them home, they get to go and try to live their normal lives, get their feet back under them. You guys also have a support group. Talk about that support group. What does that go to serve? Who can that help? And what have you guys seen in that support group, and how has that helped people?
Yeah, it's open to the public. We hold our stroke support group every first Wednesday of the month, except for January and July, because those are the holiday weekends.
Yep, we've got to clear those weeks out, right? I get it. Absolutely.
But it's open to former patients or any stroke survivor and their caregivers. It's an opportunity to talk with other people who've had strokes. As a therapist, I don't know what it's like to have a stroke. I just know how to improve independence. So you have people who are able to identify with some of the same things that they're going through. It's also an opportunity to ask questions and share experiences together. Yeah,
in your experience, I'm sure you've encountered a number of different patients who have had all sorts of ranges of recovery, whether that be, a long road ahead of them or maybe a short road ahead of them. For anybody or any family currently dealing with somebody that has just had a stroke, you're working with them, what is your encouragement to those folks during this Stroke Awareness Month?
Yeah, just knowing that every single effort is making a positive change to the brain. So it's important to just never stop working and to focus on effort and not perfection. So even if you're 3 years post-stroke or 10 years post-stroke, there's always positive changes that can happen in the brain, and that's because our brain is wired to always make new connections.
Yeah. When we are looking toward the future, let's say we've just had a stroke, we've had a family member that has a stroke. You know, sometimes this process can be very difficult to navigate. I guess, how do you guys make that easier for the family going through one of the most difficult periods of their lives, navigate forward? What's that look like?
Yeah, it's important to really lean on that rehab team and your medical team. This isn't the first time that we've been through it, and we know how to support you. So reach out, ask questions, and we empathize that it isn't just happening. This experience isn't just happening to the stroke survivor; it's also happening to the caregiver. So it's important for both the patient and caregiver to care for themselves and just really lean on your therapy team.
Yeah. When you are talking to the people at home this morning, you know, this is Stroke Awareness Month. What do you want them to know? You know, obviously this is a month to highlight the efforts as it pertains to stroke awareness, but also what do you want them to know year-round about stroke and surviving one as well? Yeah,
so stroke is really, really prevalent. So I was saying, I don't know why they picked May, because it really does happen all the time. I read the American Stroke Association has mentioned that every 40 seconds, someone has a stroke.
Wow.
So it's really important to be conscious and aware of the signs of stroke. And so we remember that by this acronym called BFAST.
Yeah.
So B is for balance. So you may have some loss of balance. E is for eyes or vision changes. F is face, facial drooping might be seen, arm weakness, speech difficulties like slurred speech, and then T is time to call 911, because the faster that we act, stroke is able to be intervened. And on certain strokes, there is medication they can give to stop the stroke and reverse it if it's caught on time.
Wow. So again, time, it's not only just time to call 911, but it refers to the length of time. You got to act quickly to help save that individual.
Yes.
Jamie, thank you so much for your time this morning.
You.
It's been really insightful to hear everything you've got to say, especially your experience as a speech language pathologist, but also some pretty good tips when it comes to stroke. We appreciate it.
Thank you.